Hello and welcome, medical students. Today, we will delve into the fascinating world of mycobacteria, a unique group of bacteria that have significant medical implications. We will explore various topics relating to the pathogenesis, diagnosis, and treatment of different mycobacterial infections. So, let's begin our journey into the intricate world of mycobacteria. Leprosy, caused by Mycobacterium leprae, primarily affects the skin and nerves. Diagnosis includes clinical features, histopathology, acid-fast staining, and PCR. Treatment is multi-drug therapy with dapsone, rifampicin, and clofazimine to eradicate the bacteria and prevent resistance. Non-tuberculous mycobacteria, NTM, are a diverse group of species that can cause diseases in both immunocompromised and immunocompetent individuals. Diagnosing NTM infections involves various methods such as microbiological culture, molecular testing, and radiological imaging. Treatment requires tailored antimicrobial agents based on the specific NTM species and drug susceptibility. Mycobacterium ulcerans is a bacterium that causes Buruli ulcer, a disease mainly seen in West and Central Africa. It is associated with stagnant water and produces a toxin called mycolactone. The disease presents with skin lesions, ulcers, and tissue damage. Mycobacterium avium complex, MAC, comprises two closely related species, M. avium and M. intracellulaire, which can cause a spectrum of diseases, primarily in individuals with compromised immune systems. Diagnosis of MAC infections often involves a combination of clinical evaluation, radiological imaging, and microbiological culture. Treatment approaches for MAC infections depend on multiple factors, including the patient's immune status, the site of infection, and the severity of disease. Multi-drug regimens incorporating antibiotics such as clarithromycin, ethambutol, and rifabutin are commonly employed to tackle these challenging infections. Genetic diversity, antibiotic resistance, and treatment challenges. The Mycobacterium abscessus complex consists of three closely related species, M. abscessus subsp. Abscessus, M. abscessus subsp. Bolidii, and M. abscessus subsp. Maciliense. These bacteria are notorious for their ability to develop antibiotic resistance, making treatment challenging. The genetic diversity of the M. abscessus complex plays a crucial role in its antibiotic resistance patterns. Understanding the genetic mechanisms underlying resistance can guide treatment decisions and the development of novel therapeutic approaches. The Mycobacterium fortuitum complex encompasses several rapidly growing mycobacteria that can cause a wide range of infections in humans. These infections primarily affect immunocompromised individuals or those with certain risk factors. Accurate identification of the causative species within the M. fortuitum complex can be challenging, requiring advanced molecular techniques and phenotypic characteristics. Treatment options often involve a combination of antimicrobial agents tailored to the specific drug susceptibilities of the isolated strain. Mycobacterium cancaceae is a slow-growing non-tuberculous mycobacterium associated with pulmonary diseases resembling tuberculosis. Clinical presentations can range from asymptomatic lung abnormalities to severe, progressive infections. Determining the drug susceptibility of M. cancaceae is crucial for selecting appropriate treatment strategies. Combination therapy with antimicrobial agents such as rifampicin, isoniazid, and ethambutol is commonly employed to achieve favorable outcomes in M. cancaceae infections. Mycobacterium marinum is a waterborne mycobacterium responsible for a characteristic skin infection known as fish tank granuloma. This infection primarily affects individuals who come into contact with contaminated aquatic environments. Understanding the molecular pathogenesis of M. marinum infections can provide insights into its ability to invade host cells and establish chronic infections. Diagnosis typically involves a combination of clinical evaluation, histopathological examination, and microbiological culture. Mycobacterium haemophilum is an uncommon, slow-growing mycobacterium that primarily affects immunocompromised patients. It can cause a range of clinical manifestations, including cutaneous and subcutaneous infections, joint infections, and systemic infections. Diagnosing M. haemophilum infections often requires specialized laboratory techniques, such as PCR and molecular identification methods. Treatment options may involve a combination of multiple antimicrobial agents tailored to the specific clinical presentation and drug susceptibilities. Mycobacterium gordonii is a potentially opportunistic mycobacterium commonly isolated from environmental sources. However, its pathogenic potential in causing human infections remains a topic of debate. Insights gleaned from clinical case studies involving M. gordonii infections shed light on its association with specific clinical presentations, risk factors, and potential treatment options. Further research is needed to fully understand the clinical implications of this species. Accurate laboratory methods for isolating and identifying mycobacteria are crucial for diagnosing and managing mycobacterial infections. These methods include culture-based techniques, acid-fast staining, microscopy, and molecular techniques such as PCR and DNA sequencing. Culture remains the gold standard for mycobacterial isolation, although it requires specialized growth media and prolonged incubation periods. Microscopy techniques, such as acid-fast staining, aid in rapid screening, while molecular techniques offer faster and more accurate species identification. Treating mycobacterial infections poses unique challenges due to the emergence of drug-resistant strains and the ability of these bacteria to persist within host cells. Understanding the mechanisms of drug resistance can guide the development of novel therapeutic approaches. Combination therapy involving multiple antimicrobial agents is frequently employed to prevent the development of resistance and enhance treatment outcomes. Additionally, immunomodulatory strategies aimed at boosting the host's immune response play a crucial role in optimizing treatment outcomes.